Thank you very much, Program Director, Dr. Sundip Ruda, distinguished guests, honorable delegates, academics from various institutions, our visitors from outside South Africa, ladies and gentlemen, good morning. Firstly, I would like to thank the Diabetes Frontier Africa and the organizers of this event for inviting me to share some insights in this august event. I fully appreciate and support the decision that was taken by the organizers to ensure that all key stakeholders, health department, and everyone who works within the diabetes space are included in today's program. This will help us appreciate the value of collaboration as opposed to working in silos. But why am I here? I think the introduction said something different. I'm the founder and the patron of the Bongi Ngema Zuma Foundation, which was established in 2010. My mother, Priska Ngema, lived with diabetes for over 20 years, about 28 years to be precise. First diagnosed with the gestational diabetes, and no one explained what it meant to her. And she lived on to later be diagnosed with type 2 diabetes. But the learnings from my mother is that she made it her family affair. We all knew when she's going to the clinic. We all knew what her readings were, but we did not understand because no one had ever told us what it means to be diabetic. And I don't think she even knew what it meant. So I grew up from a family that has diabetes, like left, right, and center. My aunt from my paternal side also lived with diabetes, and I did not know why she was injecting when my mother was taking pills, and nobody explained. Until I think the time that I decided to work or to close the gap. When you are put in the platform of being, by default, to a spouse of the president, there is so much attention towards you. So I thought to dilute that attention and let's talk about something positive and something that will help someone live an extra day. Let's share information about diabetes. And that's when I started in 2010. But I'd long been investigating and researching about diabetes. Actually, when I started my MBA, my topic was the cost to the economy due to lack of awareness about diabetes. When I presented my topic, professor first said, no, we are doing an MBA, it's a master's in business administration. Why are you embarking on a health issue? I said, I'm not focusing on health, but diabetes does cost economies a lot. Amputations, more than 1 million every year. And that money could be directed to other things like infrastructure development, IT, to help our communities grow. So I've told you why diabetes is close to my heart. Then I found a vehicle to go out to public because I could not go and say, oh, listen to me, I'm talking about diabetes. I had to create a vehicle, which is the BNZ Foundation or the Bongi Ngema Zuma Foundation. Our vision is to see a South Africa and the world where diabetes ceases to be a killer due to lack of awareness. And we then looked at the statistics and the dynamics of South Africa and realized that diabetes does not live in isolation. We have an issue of education. Our literacy rates are not very high, especially when you go to rural areas. Also, the empowerment and development of people from rural areas, peri-urban areas, special focus on vulnerable communities, which include women, children, and the aged. So we have programs throughout the year that talk to the 3 pillars that govern our strategy. So we go out to the public in different platforms. We have our very active website or social media platforms where we disseminate information to people that can access such. People that are in urban areas that can reach, the school kids and all of that. So our messaging goes to different people in different platforms. And the medium that we use depends on the target audience. Our primary target audience is people from rural areas and townships where information scarcely reach. Like I've said, in the past, I had never had anyone speaking about diabetes. So when we started our journey with the foundation, I approached Diabetes South Africa, which was an NGO that I knew that was working in that space. And we said, this is who we are and this is what we want to do. But our primary target is to reach out to the rural communities and to educate them. But more than anything, to have them screened so that they know where they stand and which way they're going. So statistics according to IDF Atlas 8th edition in 2017 said approximately 425 million adults between ages 20 and 79 years were living with diabetes. By 2045, this will rise to 629 million. The proportion of people with type 2 diabetes is increasing in most countries, especially developing countries, and South Africa is one of them. So we're not immune to this. But closer to home, South African stats, according to the MEC for Health in KZN province, that's Dr. Sibongiseni Dlomo, there are about 2,500 amputations done in KZN province annually as a result of uncontrolled diabetes. About 6% of South African population, that is about 3.5 million people, suffer from diabetes, and 5 million more are estimated to have pre-diabetes conditions. Diabetes is the second common cause of death after TB in the country, according to the statistics South Africa report of 2016 on mortality and causes of death. Around 76% of diabetes-related deaths in South Africa occur in people younger than 60 years, the most economically active age group of the population. Health expenditure for diabetes for adults in South Africa is projected to increase by 50% between 2010 and 2030. Now, what should be done? What should be done? I think collaborations like this, where you gather people that talk the same language, those that are academias, the corporates, and us, the civil society. I've just seen one of the most influential public figures also entering the room. We need those people to speak out. We need to have more groups of people that talk about diabetes and say diabetes must be put at bay, because it can. Diabetes is a tsunami calling for expedition of awareness campaigns, starting from health and awareness education and promotion of sports, for example, in schools. When we went to schools, we had sports competitions, and it was a given that you will participate in one sport or the other. It wasn't like you choose. But now lately, with our kids going to private schools, everything is privatized. So you pay so much money for the school, but then when a child wants to participate in sport, you must pay extra. We have to make that available to everyone. Dr. Sunjip, I'm sure this can be a family thing. We've tried with the Department of Sports as a foundation to say, let's make sports freely available for every citizen, not for only professional sports people. And we've given them a model of how we can do it as a fun day where we all participate. Public engagements, you've touched on that, Dr. Goff. Churches, civil society, we have a large community that participates in stokvel groups where people gather and put money together, save together, and they buy, bargain, especially for Christmas. Taxi ranks, that's where our communities gather in big numbers. And workplaces, public engagements that involve screening so that we know where we stand and where to start. I was very much enthused when we were talking about your model that you have started, because we are just on the edge of starting something like similar in one community where we reached out to with a diabetes awareness program in 2015. It's a school where we first assisted the school. The learners, 25% of the learners are indigent, so we helped them with school uniforms and all of that, and their performance at school became better because everyone was equal now, have uniforms, shoes, and all of that. And then even in that, they had a library where there were no books. We, with the help of partners like Rotary, we managed to fill up the library with books. We also donated computers to the school. The school has an ample ground that was just there growing thorns. So we asked them to turn that into a garden or have community participating in gardening there. We invited KZN farmers. They helped us to tilt the ground to start, the project of gardening. But now the school has a problem with baboons that come and feed on the whatever. There we are still needing help for someone. But then in 2017, we got a request from the school to say, can you not celebrate World Diabetes Day here? Because this is where we go out vigorously in November and we reach out to communities and with our program, but more so we screen. We always want to screen people, starting from young ones up. But we make the most benefit of the day by inviting other NGOs that do HIV and AIDS counseling and testing. Then we invite Department of Health. They can screen for ears and eyes. So everyone participates. So the school's itching point was that they were having a learner who has type 1 diabetes. And they did not know how to handle the learner when she collapses in class. They don't even have a machine to prick and see what the readings are. And they would always wait for the mother to come and take the child to the clinic. So that is why they wanted this education to come, because they felt as teachers they don't know what to do. So they need more knowledge. We went there. We had a participation of more than 2,500 community members. Well, the school children were screened for the other ailments, but then we also screened for diabetes. And in that outreach campaign alone, we found 2 more children from the same school that are now followed for type 1 diabetes, because their readings were like 16, the one was 11. And we tried pushing down. Fortunately, we have professional nurses that we work with as an NGO. We have Dr. Kibamba here, who is also one of the doctors who volunteer their services to the foundation. We have people that are called Friends of the Foundation who are professionals in health. So those, for us, are the things that we pick up as we go around. In that outreach campaign alone, we screened about 951 people. And many of them, like you say, obesity is a challenge. We are one of the world's biggest populations. The stereotypes about BMI and all of that. I think on that one, I also have a stereotype. Yeah, but the stereotypes about how you should weigh and all of that and what you should eat. But we have managed, as the foundation, to break it down to the languages that people understand. So we have our diabetes pamphlet that is translated into 7 out of the 11 official languages. So when we go to Eastern Cape, we have it in Xhosa. When we go to Giyani, we have it in Tsonga. Because those are the corners that we have reached. We are based in Gauteng, but we operate all over the country. So people look at the food, and we always, when we talk to them, talk about the food that they normally eat and educate them on how to prepare and all of that. And what emanated from the very World Diabetes Day campaign, where I say we reached out to Molweni, is that the community, we had the community dialogues, we had the teachers, the learners, but our evaluation there was evaluating their level of understanding, a level of awareness about diabetes. And then from those groups, we had people presenting what they knew about diabetes, and then after, the nurse educators gave them education on the stereotypes that they knew and all these myths about diabetes. Then we had group representatives presenting back on what they have learned. And then we had people that, as a separate group, people that were living with diabetes. And we had one who said, had I gotten this information earlier, I would not be where I am today. And that's a person who volunteered to start a diabetes support group, a chronic disease support group in that area. She has registered 50 members. We have spoken to the district Department of Health, but as an NGO, we need funds to have that program running. You spoke about pedometers, you spoke about all those things, resources. So Dr. Sondip, through your connections, that program has to start. It has delayed, but we are ready to start a pilot like that one. We are having people that are registered. We have people that we've appointed as people that will educate. And then we've also jotted down, similar to what we have done, the exercise, because those are the things that they called. They said they want aerobics classes. They said they want to be screened regularly, not to wait for the day that they go to the clinic. Because our population, they wait for the day of going to the clinic to know where they stand, because most of them do not have the glucometers. Even if you do not donate glucometers, the straps are too expensive to buy. You mentioned in your opening speech, Dr. Sunip, that to even get people to go and get their medication, there's a challenge of money. People in that community that I'm referring to, the level of unemployment is about 85%. So very few people work. And so to have them participate in this, we need people that will write a paper from the findings, because we also want to do it, thoroughly, and so that we know what we have done. More for us on the education side. We need the role of NGOs and how far they reach. We always brag about being able to go down to the chiefs. We have rural areas here. The protocol in rural areas is different from the protocol in your municipality, where you write to someone in writing. You have to physically go there and bow down. If you have to take off your shoes, you do. We do that. We've done that in Kiani. We worked with a royal house of Mabunda Royal House. We went 11 times before the actual date that we went, where you see people walking, 6,000 participants. 5 villages passed to where the chief has called the people, because there people only listen to the chief. But we've done it. And we have that acumen as NGOs, and we want to be used. We want to help our people, because as a philanthropist, you are first and foremost driven by the passion to close the gap where you see one. I always say, we should not even say this is a diabetes NGO, this is what. It's a person with a dire need to help close the gap. So that is where we are. So we want to be used. We are still pressing on with the little resources that we have. I cannot overemphasize the importance of collaboration. It has been mentioned here, because the government charts the policies. The NGOs are ready to present. Our successes in HIV and AIDS, where we are now talking about less than 2% of mother-to-child transmission, though we're still a leading country in HIV and AIDS, but we have succeeded in bringing the life expectancy longer. People were dying like flies, but the NGOs on the ground helped drive the message, and you will agree with me. So we need to drum the same with diabetes. I think we are too mum or quiet about diabetes. If you visit the United States, you open any TV channel, in the morning, during the day, there is something about diabetes. Something said. We only wake up on the 1st of November. Hey, it's diabetes month. Hey, this morning, I don't know how many interviews I've done on radio. And when we ask for interviews during the year, they are just, but this month everyone wants to tick that they've said something. Is that enough? It's not enough. We need media partners. We need everyone involved. Diabetes is for everybody to roll up sleeves if we are going to succeed. So the challenges facing the NGOs, as I've mentioned, here is a program ready to start. There are no finances to get on it. We've approached pharmaceutical companies, and no one is coming on board. Some will lead you wait for 3 months, you go back and forth to their offices, then no, you are politically aligned. Is diabetes politically aligned? Does diabetes only kill politicians or certain political group and not? So I find it very much, of a joke when a company that claims to have products that are cheapest choice, that are used by everyone. I'm not saying politicians don't buy our products, because if an NGO is politically aligned, and how am I politically aligned when I'm not a politician? Now, that's the challenge facing the Bongi Ngema Zuma Foundation and all other NGOs in the diabetes space. Same thing. You just knock your head on the block and no one wants to come forth, except the few. I've just, I think in the past 2 weeks, Googled 50 top companies in South Africa and looked at their CSI. You know, what do they want to invest? Including companies that make the most used drug, metformin. Diabetes is not at the top of their CSI. They don't want to be responsible for people with diabetes. They rather choose polio and malaria, when in South Africa, diabetes is the second cause of death. 50 top companies, none has diabetes as a focal point. If I was a devil, I would say they must have diabetes so that they will wake up. But now, in the future, what is going to happen? Investment in infrastructure, education, and the rest will be fruitless with unhealthy society. People continue to die from preventable type 2 diabetes causes. People continue to die from all other diseases except HIV and AIDS, not except, but over and above. So we need to shift our thinking, capitalize on the good and the success of what we did with HIV and AIDS to be able to manage it. Now people talk freely about, I'm taking tablets. You know, they share information. In the past, it wasn't like that. But because everyone got involved, I wish to hire treatment action campaign to help us say more about diabetes. But we need to mobilize more people to speak openly about diabetes. I'm happy, Sophie, that you are here as one of the public figures that I also look up to say, I stand up to say, I am diabetic. It's not a sin. And you can live positively with diabetes, because people get a fright when they're diagnosed with a chronic disease. I also blame our systems. When you go for HIV and AIDS counseling, you have screening, you first sit with a counselor who explains what it means. This is the test you're going to take. If the results are positive, this is what it means. Before you start your medication, in most cases, you have to attend a 2 weeks class to know how it multiplies in your blood. And if you miss a tablet, this is what's going to happen. That doesn't happen with diabetes. People are told standing, oh, you need diabetes, come back next Thursday. It's diabetes day, you have to come and collect your tablets. They don't know what it means. And that is why they don't comply with medication. So when you talk to people in the language they understand, you explain what it means. And you explain the importance of taking your medication as the doctor prescribed. Because in these groups, people tend to share, oh, Udlama, I'll take. Oh, you also take these tablets, I'll take. But when are you supposed to take yours? So we go down to those explanations to say, don't become a sudden doctor because you are diagnosed with diabetes. When you're told to take your medication 3 times a day, you take it all at once at night. Because the repercussions are, you will go into a coma or something. So you have to go down to those basics. But those are the dynamics of the people that we reach out to. The best investment for the future is one that is centered around people's health. South Africa is the second largest obese society in the world. Therefore, we need to invest in health awareness campaigns, nutrition programs, one home, one garden. We have that. When we educate, we say, please plant your own vegetables. I don't believe the food that is labeled organic in the shops anymore, because organic pineapple, when you have it in the kitchen, it smells the whole house. So if you plant your pineapple, you will have that smell. I plant green peppers in my garden, and I take my green pepper and the green pepper from the local market. When I cut my green pepper, you can smell green pepper. because it has grown over a month or 2 months or 3 months. To be sure that you are having organic food, that's number one. Also, while you do your garden, you exercise. So that is the message that we send through. We also, the investment that encourage physical activity through investment in sports and recreation. The Minister of Sports participated in our recent World Diabetes Day outreach in Pretoria. That was on the 3rd of November in Pretoria West. Also there, we screened about, it was 519 people for diabetes, so glucose and blood pressure. However, we had 97 people screening for HIV and AIDS because we invited VETS Reproductive Health Institute to do the pap smear, the HIV AIDS counseling and testing. We invite as many people as they can be. And they were also applauding the platform, saying they've never in a church gathering screened that number of people. And there were new cases diagnosed on the day, and there are follow-ups taking place. But on our side, people have many beliefs. People believe in the healing power and all of that. And for us, it opened another chapter of saying, awareness, awareness, awareness. Educate, educate, educate. There is no other way. There was a child whose readings were, Dr. Dr. Kibamba was there, 13 point something. Then she's with the mother. This is a 3-year-old. And then they make a drink, whatever, they were nurses, professionals, I don't know what they did. But then after 2 hours, screening again, still, it has not gone below 10. And they're trying to explain to the mother is refusing, saying no, it can't be. And many children. And if you look at the escalation of the number of children with type 1 diabetes, more than 1.1 million in the world. How are we immune to that? And those are things that we come across daily. But we lack the person that will record this data and analyze it so that we can put it forth to influence policy, to say, we cannot say when you go to a hospital, you only check for BP, it's compulsory, they don't even ask your permission. But they must do the pricking as well and not exclude children. And not exclude children. We don't exclude children. Below 12, you must be accompanied by a parent, or you come with a consent from a parent, but over 12 years we can. We screen and we find new cases every day. Spreading the message of the hashtag Know Your Number and Family and Diabetes. We have this campaign, hashtag Know Your Number, we started last year, but we want to go to all corners. We need people to invest in that, because that's where we say, unless you know where you stand, because many people don't even know that when you talk about family history, oh, my grandmother had it, but they think it's their grandmother. We've tried including a storyline in one of the most popular soapies. It doesn't send the message home. They think it's that person who has it in that story. So it has nothing to do with them. So we have to explore all different methods. But what the model we have works. We always start with a 5-kilometer walk, 3 kilometers depending whom we are targeting. We have aerobics, just to show that you don't have to pay a subscription, a gym subscription to exercise. And it works. We always call people, screen for everything. Sometimes, at some stage, we've invited Department of Home Affairs to come and do applications for your ID and whatever, so that there is something that attracts them to come. We've invited SASA, social development, people that have challenges to come and complete the forms and meet the councillors there. It helps to mobilize. But without the NGOs on the ground, we are the foot on the ground, foot soldiers. We are ready to do anything. Now, let us all join hands for people with diabetes, and let's act today to change our tomorrow. Happy commemoration of World Diabetes Day to all of you. Our website is www.bnzfoundation.org.za. Please do follow us, even on Facebook, Bongi Ngema Zuma Foundation. Thank you very much.